This is News in Depth with me, Effie Mphande. Cerebral palsy is a term given to a disorder which appears early in children where a child suffers a disorder in movement. It is a condition where the movement of the body is involuntary. Muscles behave as if they have a mind of their own. The left leg does not know what the right one is doing, and so forth. Cerebral palsy is serious and in most cases a permanent condition that is eased to some extent with physiotherapy. Those signs and symptoms vary. This condition generally takes a familiar path. This includes poor coordination, stiff or weak muscles, trouble swallowing, speaking, and tremors, among others. In today's edition of News in Depth, we zero in on Kabwe Chilupe, who has lived his entire 32 years of his life with this condition. Join me as I find out how he has managed to do so.
I am used to lifting him because, well, we've been together our lifetime. Yeah, so that's how we do it. It's easier to carry him.
His birth was normal like and so was his growth until he was 11 months old.
Well,
and then it happened.
Smile. That's nice.
They said it was a fever whose temperature shot up into uncontrollably convulsions. His mother rushed him to hospital. But unfortunately, more damage than good was done there. This is the long and short of Kabwe Chilupe's story.
They are nice people, but you were not very pleased to see them. Why?
The story as told by this family is that when he was hooked to the oxygen cylinder, the device did not have any oxygen in it. Since he was having difficulties in breathing, his brain was deprived of the essential oxygen. Consequently, Kabwe suffered irreparable damage to this vital organ. This is how Kabwe Chilupe was left with a disabling condition resulting from a damaged brain called cerebral palsy. When is it turning 33?
When it was visiting hour, about 16:30, a lot of people came, but one of my brothers came. And because he was a flight engineer, he was knowledgeable about how a person would look if they are not receiving oxygen. Apparently, he was turning blue. His nerves were turning blue. So he asked me and said, why is he turning blue? And I said, I don't know, because I was young and not very knowledgeable, of course. So he's asked for a nurse to bring a bowl of water to check if there was actually oxygen in the cylinder. But unfortunately, there was no oxygen. So all this while that they thought he was on oxygen, they had suffocated him even more of oxygen. I don't know whether that worsened the condition that he would have turned out to be. I believe it did.
But even then, Mavis did not lose hope.
I looked at him. My mother thought he was dying, okay? And she packed his things, took out his things from the locker, went outside and started crying and thought he was dying any minute. When I saw that happening, I moved from his bedside. I went and knelt down by a window in the passage and prayed. I prayed sincerely to my God that day. In fact, I don't think I remember praying that much before or after. And as I was in the middle of my prayer, saying to God that I didn't want my son to die, I told my God that whatever condition, as long as he survives, I heard a soft touch on my shoulder and a whisper in my ear. I heard somebody saying to me, don't worry, he's going to be okay. At that very moment, I got up. I realized my sister had come and knelt down beside me, my immediate elder sister, Jackie. I got up and went outside. I said to my mother, don't worry, he's going to be okay. I even took all his stuff that they had wrapped up in a chitenge, went and started packing them in the locker. my mother started worrying about me, obviously thinking I'm now losing my mind because of the condition of my son. But I was so convinced in my mind that he was not going to die. I had that much faith. When I went back, that's when Professor Chintu appeared from nowhere. So to me, that was like God sending me the angel that he promised. You know, he just went into the room. I didn't know him. I just saw that he was in a doctor's robe, went into his room and came out and asked, who are the parents to the boy in the emergency room? I said, it's me, because I was right there by the door. Then he asked, is the father around? I said, yes, he was standing a little far. So I called him. He came. He touched both of us on our shoulders and said, you know what? I want to try something with your boy. I don't have time for you to give me any written consent. Let's just give me decide if you can give me the chance to try something with your son. He didn't even go into explaining what he wanted to try. But again, because I had faith, I thought whatever he wants to do must be good, must be something that will save him. So I nodded and said yes, and the father also nodded and said yes. So he said, okay, called the nurse, as if it was in a movie, eh? Called the nurse. I'm going to disconnect everything, the drips and the monitor and everything. I know anything can happen between here and the D block, but I've got the permission from the parents. So he asked the father if he had a car and asked him to bring it to the front of the ward and ordered the nurse to take him, wrapped him in a blanket, went and sat behind the car. He sat in front. The father was driving the car. My mother, myself, my sister, and everybody else who was visiting were running after the cars. They were driving to D block. So we got there, we got to D block, and the doctor, Professor Chintu, put him in an incubator as we were watching over from the window. He put him in an incubator, connected everything, did whatever he had to do anyway, and we were just watching. He waited for a few moments because he had connected the heart monitor. And then he said, I've done it, because the heart monitor started moving, showing that his heart was still beating. And we were all so happy and overjoyed that, well, at least he hadn't died between the movement from pediatrics to D block.
What exactly is cerebral palsy and what are the causes?
Cerebral palsy, it's a condition that results of a damage to an area of the brain that controls the muscles. And this point in time, we need to say exactly what it is, because at times you find someone who is maybe in his, an adult, who may be having a high blood pressure and having what we call cerebral vascular accident and losing the speech. I'm sure you've seen people like that. So with that particular condition, we don't call it cerebral palsy because this is an adult. So when we're talking about cerebral palsy, it's a damage to an area of the brain that controls the muscles, but this damage happens on a growing brain.
Any disturbances that can happen during the development of the baby in utero, like in the mother's womb, if the mother has an illness, cardiac disease, disease of the kidneys, if the baby has a stroke while in the womb, or infections. Also during delivery, in our setting, actually we see most of the causes of cerebral palsy to be somewhere around the time of delivery, and one of the most common causes is actually birth asphyxia, where a baby has low oxygen going to the brain, and so as a result of that you have a baby developing cerebral palsy later in life. And then after delivery, it's usually infections, with meningitis and encephalitis usually being common causes of cerebral palsy.
This is the University Teaching Hospital's pediatric wing. Cerebral palsy patients are seen from the neurology clinic inside this building. One of the local doctors told me that there is usually a long queue of children who are brought for review. But what is the scale of the problem of cerebral palsy in Zambia?
We have a problem with statistics, just like other developing countries. In the West, it's well documented, but the statistics that are in the developing world are said to be scanty because, as you know, it's not every area that's been provided with adequate healthcare. So you have a lot of babies being who are not counted as having this problem, but it is quite a frequent problem. In our neurology clinic, which we have on Fridays, we actually see a number of children who present with cerebral palsy.
Jonathan Chanda started walking when he was 9 years old. He's now 18 and doing grade 9. But Jonathan is not without ambition. He wants to be a pilot when he completes school.
It is difficult for me. What I look for other kids who are able-bodied. I want to do like them, but I fail. I fail them other things. So it's difficult.
Jonathan was born in 1997. It has not been an easy journey. When he was born, 3 days later, after birth, it was discovered that he suffered from meningitis. So from there, after a year, in the process of his growth, I did notice that the developments were quite slow. He was not growing like any other child. He could not hold his neck, he could not sit. It took a lot of months for him to sit. That's when I took him back to the hospital, but they did not tell me exactly that with cerebral palsy I'll be able to see those changes. That's how I was engaged to take him for physiotherapy for when he was about 3 years. So from that age up to today, he's been attending physiotherapy. However, it has not been easy as a mother emotionally, because when you're carrying a pregnancy, you always expect to have a child who is okay, able to walk in good time, able to learn like every other child.
And so we have every reason to thank him, because other people could be going through even worse than this. And even if nobody's going through what is worse, we still have to thank God, because you can never take this life for granted. Just the thought that God
News
knew
of
us
Jonathan's
before we
condition
even
devastated the Chanda family. But with time, the family accepted his condition.
Jonathan's condition affected me very badly, because it's a situation where you've just gotten married, a young couple, very excited, and then only to have a first child that has got a condition like Jonathan. And you hear of stories of how men have abandoned their wives because of a condition like that. And you could feel this pressure, because you cannot be able to hold your child and go with them as the other fathers do, and be able to show them to others that this is my son. But thank God for the support that we have in the family of God, where people come and encourage you, try to lift you up, so that at the end of the day you can be able to feel as well as any other parent does.
But the main question is how this condition can be prevented.
So one of the characteristics of cerebral palsy is that once you have it, it won't regress, nor will it proceed. And that's why some institutions actually wait till the age of about 5 years to make the diagnosis. So once the injury has happened, it is not preventable once the injury has happened, but you can prevent it by improving maternal care, improving management of pregnant women, and also reaching out far-flung areas that do not have access to good antenatal care, and just improving good community-seeking behavior in terms of pregnancy. And then also with adequate immunization of children, and because if you immunize, you have less incidence of diseases. And one of the cornerstones in managing cerebral palsy is that it can be managed, but it requires a lot of disciplines. You have the physiotherapy because physiotherapy is very important in the management. You have the pediatrician, and you have speech therapists, you have behavioral therapists, and then you also have occupational therapy. You have a neurologist, because these children usually have convulsions, they have feeding problems, so you also need to involve a nutritionist because they develop malnutrition, because they have stiff muscles and cannot swallow their food properly, so they have feeding difficulties, and that can be addressed by the aid of a nutritionist as well.
This is a condition that can be prevented. So I can just mention some risk factors. You find that a number of a good proportion of children with cerebral palsy, a number of them will be the firstborn to their mothers, and then especially when the mother is very young. And that's why it's we need to encourage our mothers to have babies when it's an appropriate time, because when you have babies born to young mothers, most of the time you have what we call, this is a medical term, where the head is too big to go through the birth canal, and then some of them, when they go into labor, their head is stuck, and that can lead in fact to cerebral palsy, because this baby won't be able to breathe, and then when the baby comes out, the baby is flat, and because the baby is flat, the baby cannot breathe, and then the brain will be affected. So that's one of the risk factors. So it's having very young mothers and having their first baby. That's one. Yeah. So and then of course we discussed. Remember we said then infections. Infections, there's so many of them, and that's why for pregnant women they are advised to go for their antenatals as soon as they know they are pregnant. They should report to the nearest clinic so that they are followed up, because then there's a screening for a number of infections, so that, and even prevention, then they can prevent them.
As of December 2014, 1,987 children were attending physiotherapy services in Lusaka. Of this number, 547 were new cases, and about 350 were from UTH. About 80% of the children have cerebral palsy. However, the statistics do not include old patients who missed their physiotherapy sessions in 2014 or those who have died. Mika Simpamba is a senior physiotherapist at the University Teaching Hospital and now explains the importance of physiotherapy for children with cerebral palsy.
Sometimes the child will have stiffness in the joints, or the muscles are stiff. So if you are not doing any physiotherapy, that stiffness will develop into what we call other complications such as contractures, where the muscles, because they are stiff, they are just in one position. The child is failing to move. So a child will be fixed in that position. And we have so many children who have gone to that extent, because as the parents are bringing them, because most of the children with cerebral palsy, they may not walk. But if the parents do not understand the complications which may come due to lack of physiotherapy, they may stay home. And then when the child develops contractures, it's difficult to stretch. Once a contracture is developed, it's difficult to stretch using physiotherapy, maybe through surgery. But again, the problem which is causing that contracture is from the brain. So even if they do surgery here and there is no physiotherapy, again the child will go back to develop contractures.
What are the signs and symptoms of cerebral palsy?
Children with cerebral palsy will present with delayed milestones. There are certain milestones that we expect babies to achieve, like we expect them to smile by 6 weeks, to sit by 6 months, to walk by about 1 year. But one of the things is that a child with cerebral palsy will not achieve these milestones when you expect them to, because of muscle problems, because of weakness. And so such children who parents are concerned about should be taken to the nearest health facility for evaluation, and then there they'll look into the history of the child. How was the delivery? How was the pregnancy? How was the period after? To evaluate if cerebral palsy could be a cause, or indeed other causes that could lead to such a presentation. Yes.
What's the recommended age for a child to walk?
So a child is supposed to walk by 1 year, but we give them an allowance usually even up to 1 year, 2 years. Some delay walking, especially if they were premature, because if they were premature, you will not measure them according to the same standard as a child who was term.
Kabwe spent most of his infant life in hospital. At 1, experts believe he was the oldest baby to be in an incubator. Since Kabwe was born in September 1982, Mavis has lived her life for her son. She worked in the formal sector, but not for too long. Mavis has had to take care of him. She tried everything possible to get her son better.
I did go with him to the British Institute of Brain Injured Children. This is in Bridgewater, Somerset in England. I went with him alone. I didn't have a wheelchair, so I carried him most of the time on my back. But when we got to England, when I was coming off the plane, the hostess said to me, no, wait, a wheelchair will be brought for you. So I thought, oh, wow. So I sat in the wheelchair, holding him on my lap.
But in the United Kingdom, something went wrong. The house she lived in caught fire.
The fire started from his bedroom. There was a gas leakage in one of the pipes. I was sat with him in the front room, just feeling lazy to take him to bed early. I thought, I'll take him, you know. It was just one of those days when I thought, I'll take him. It doesn't matter if he sleeps late today. And before I took him to bed, the fire alarm went off. And I'm thinking, did I leave the cooker on? I rushed to the kitchen. I found the kitchen was clear. And I thought, where is this coming from? Is it faulty? Because it wasn't long before they fitted it. I was trying to go to where I thought the smoke was coming from. I opened his bedroom door, and the smoke actually pushed me back. The room was all gutted, but because the doors were ones that closed tightly, it took long before we could actually get the fire alarm, off, and for me to start smelling the smoke. I just went and grabbed him, Effie, and the lights went off at that moment. Walked down with him in the dark. I had no shoes. This was about February, one of the coldest months. He was not properly dressed because the room was central heated. The house was central heated. I just walked out to save ourselves.
Kabwe will be turning 33 on 29th September.
I really didn't think that it would be like this for life. He was 11 months only. I thought one day he'll come around like he did. He was almost dead. So I kept praying, and even if it wasn't him getting fully recovered, I thought he would improve to a stage where you can even just communicate. We communicate in a very special way, I'm sure you have noticed, but where he could even speak, or where he can feed himself, or where he can sit. But no, that hasn't happened.
What rehabilitation facilities are available in Zambia?
Remember we said that this is a condition that affects certain areas of the brain that control muscles. And for you to speak, you need to use your muscles. For you to swallow, you need your muscles. For you to walk, you need your muscles. So depending on the severity of the condition, some may have problem walking, some may have problem swallowing, and some may have problem speaking. And then I want to take this opportunity to mention that children with cerebral palsy are not mentally retarded. Because some people, they say, because they see this child walking in a certain way, or this child not moving, not even not talking, they may think the child is what? Is mentally retarded. It's just that the muscles are not responding to the commands coming from the brain, because the brain itself is somehow damaged. Yeah. So then when it comes to rehabilitation, for the one that got a speech problem, yes, and then we need a speech therapy. And then you find that, when you look in Zambia, we don't have so many of them. It's one discipline that need to be to come on board when it comes to rehabilitation. We need to have more people trained in this particular area of speech.
What we call the gross.
Dr. Chilupe Chungu feels there are certain things that should not be ignored.
Important things are this sunshine therapy thing, actually. It's very common. You have a child who was kept at home, and then you ask to say, why wasn't this child brought to the health facility? And then they say, no, the grandmother said, just put in the sun. But for any child whom you're suspecting is yellow, it's always nice to have them evaluated in a health facility. And then also just taking children to the hospital as quickly as possible if they're unwell, and also following under 5 clinic attendances that can help reduce incidences of things like cerebral palsy, as well as meticulous obstetric care.
Mavis and the Chanda family have been through a lot, but they still had words of encouragement for those who may be in the same situation.
I always have come across, even just when we go for hospital visits, I see people with children like Kabwe. They sometimes tend to get irritated and tired. Yeah? You find that a child is crying and they're like, hey, stop crying, shouting, screaming at the child. I never do that to Kabwe. But that I attribute to God's grace. They must be patient with children like this. They need love. I think Kabwe, besides the good food, Kabwe has lived mainly because of the love that he has experienced, not only from me, even from the people around me.
I would like to encourage parents who are out there who are like me, going through the same situation, probably worse a situation, that they should look to God. They should actually give the challenges they're going through to God, because God is able. He has never failed us. So he's the one who is going to continue giving them the strength. Family sometimes can fail you. Friends can fail you. But with God, you can never go wrong.
And one thing that really scared me was the thought, if I have to drop dead today, who really can be able to handle my son in a manner that I or us as his parents would be able to do it? Because I realized that surely if people cannot be able to take care of children that are whole, what about him? What would happen?
Well, that's all we had for you on today's edition of News in Depth, where we're looking at cerebral palsy. Would like to sincerely thank Kabwe's sister, Wandi, who convinced the mother to tell the story. Wandi wants to be an advocate for children with cerebral palsy when she completes her studies. Thank you for watching. Join us next week with another interesting program. From me, Effie Mphande, it's goodbye.